Today we're going to be looking at the NDPERS health plan options in retirement. NDPERS offers a secondary payer insurance with Medicare and a Part D supplemental that is bundled together as a combo deal called the Dakota Retiree Plan that is available to our retirees if they or a dependent are Medicare eligible. To enroll, though, you must have a qualifying event. When you retire or have retired, there are qualifying events that permit you to enroll in the Dakota Retiree Plan. As you can see, there are 3 events that allow you to enroll, and you must be enrolled within 31 days of the eligible event. 1, receive first retirement payment. This is the big one. There's no getting around it. If you're not drawing your pension, you can't come on this plan. Second one, loss of group insurance from an employer. Individual plans don't count. You have to have either our insurance or an employer-sponsored plan that you leave to be able to qualify. Having a plan of your own that you set up with your Affordable Care Marketplace doesn't count. 3, become Medicare eligible. This does not have to be a retiring member. It could be a spouse or a dependent child. You see below that NDPERS offers 2 plans. The Dakota Retiree Plan for Medicare eligible members and the Dakota Plan for everyone else. The Dakota Retiree Plan is a bundled plan, which means the secondary insurance to Medicare and the Part D prescription drug plan are together and cannot be separated. The Dakota Plan is for everyone else. It is a preferred provider organization health plan, which means the participants are free to use the services of any provider within their network. If you have a Medicare eligible dependent, everyone else who is eligible will be on this plan. Let's deconstruct the Dakota Retiree Plan. It can include 2 separate health insurance plans. One is for the Medicare eligible person, and the other is for the person or persons that are not Medicare. To be on this plan, everyone in the family must be Medicare eligible and has signed up for Medicare Part A, which is hospitalization, and Part B, which is medical. When this happens, Medicare becomes the person's primary health insurance. The federal government becomes the primary insurance and pays up to 80% for the Medicare recipient. When you are on the Dakota Retiree Plan, we insist in paying the 20% of the coverage that's left over. So if you have a treatment or you go visit a doctor, 80% of that visit is done by Medicare, and we take care of the remaining 20%. No copay, and the deductible is paid by us. The Dakota Retiree Plan also provides coverage for Medicare Part D. We have more in-depth videos on this subject in our pre-retirement series on the NDPERS YouTube page. Sanford administers the health insurance portion of the Dakota Retiree Plan, and Humana administers the Medicare Part D. The Dakota Plan is what active employees who work for the state or the political subdivisions like schools, cities, counties that have our health insurance plan. This is the health plan you are currently on, which is administered by Sanford, and the prescription drug coverage is administered by Optum Rx. If you should go on COBRA in the event you leave employment or you retire and nobody on your family is Medicare eligible, when you go on COBRA, you're still on the Dakota plan. You're still on the same plan that you had when you were an active employee. The great thing about the Dakota Retiree Plan, it allows the member or their family members who are not on Medicare stay on the non-Medicare plan that active employees who have the insurance with NDPERS. Depending on the situation, you and your eligible dependents may be eligible to enroll in the Dakota Retiree Plan. We have 3 scenarios that permit you and your family to enroll in the plan. We will also go over some of the examples that pertain to you. With the first scenario, neither you nor any of your eligible dependents are Medicare eligible. It's in this situation a member would enroll in COBRA. Remember, if your employer does not have NDPERS health insurance, you don't contact us. You would instead contact your employer. The other alternative would be to go out to the Affordable Care Marketplace. Now, this doesn't mean you can't come on the Dakota Retiree Plan ever, but with the right qualifying events, you can eventually enroll. As for example on our screen, you are 58 and your dependent 63 and a half. You can enroll in COBRA for 18 months. Then when your dependent becomes Medicare eligible at that age of 65, you can immediately move on to what we call a One Medicare plus others. And really what that means is it's the Dakota Retiree Plan plus the Dakota Plan. Your spouse is now on the Medicare portion of it, and you're still on the Dakota Plan, which is the same plan you had when you were an active employee. Also, if you can see that little small Script down below, non-Medicare others can remain on this plan until they become Medicare eligible, or if a child dependent until age 26. So your children can be on here as well. Example 2, in this case, the person is 58, their dependent's 59. They both roll in for COBRA for 18 months. After that 18th month, neither one of them are Medicare eligible. That's when you would have to go out to the affordable care marketplace. And then later, when once one becomes Medicare eligible, in this case, the dependent who's 59 would get to Medicare eligibility first. Later, you could actually enroll in the Dakota Retiree Plan. All right, with this example on scenario 2, you have a member who's not eligible for Medicare, but is retiring, but has a Medicare eligible dependent. A few years ago, I assisted a member who had a dependent child who was disabled and was eligible for Medicare. They were able to enroll in the Dakota Retiree Plan, and the reason was it was possible with the child was a legal dependent and Medicare eligible. In another situation, I was working with grandparents who were not Medicare eligible, but they were the legal guardians of a grandchild who had been on disability for 24 months, and the grandchild was going to be Medicare eligible, so they could go on the Dakota Retiree Plan. Now, in the cases of both these examples I presented, remember, in either situation, someone was retiring. You also can go on the plan if you or a legal dependent is becoming Medicare eligible. I had a member who was already retired, but her spouse was reaching the age of 65, so they could enroll in the plan. Even though they had been away from our active non-Medicare plan, they could now enroll with the Dakota Retiree Plan. Remember, one of the qualifying events is an eligible dependent or a member reaching the age of 65 or Medicare eligibility. Scenario 3 is that both the member and their spouse are Medicare eligible at the time the member retired and may enroll in the Dakota Retiree Plan. Many members wait until both they and their spouse are eligible for Medicare, but you don't have to. If a dependent is Medicare eligible, that allows you to enroll on what they call the One Medicare Plus Others. And again, that means one person on Dakota Retiree Plan and the other on the Dakota Plan. IndyPERS gets this question quite often. Let it be known that the Dakota Retiree Plan is similar to a Plan F. However, the Dakota Retiree Plan is its own plan and is only available to the following plans listed on the slide. As you can see, IndyPERS retirement plans, Teachers Fund for Retirement. So, a lot of times we get questions from teachers. They are able to come on our plan. The University System Higher Education with the TIA retirement plan. And just a friendly reminder, to enroll in the plan, you are required to draw your pension. When you are in one of those alternative retirement plans, such as TFFR or the TIA University Plan, you must be setting up or drawing from your retirement plan. Furthermore, you are required to provide proof that you are taking a payment by completing the verification of alternate retirement plan form. You can't enroll just because you left employment. It's not considered retired by IndyPERS. Another thing to remember, the Dakota Retiree Plan is a combo deal. You can't separate the health insurance or the prescription drug coverage. If you cancel one, you also cancel the other. So maybe you want to go with a different prescription drug plan and cancel the Humana. Well, you just canceled the Sanford portion of the plan that covers the health insurance. Most of you know how the non-Medicare plan works, and if you don't, we have a great video that goes over the Dakota plan. This page here illustrates how the Dakota Retiree Plan works. First off, I want to make sure everyone listening to this video knows that they need to enroll with Medicare, or if they're enrolling for Social Security benefits, they can enroll with both with Social Security. If you're not planning on enrolling in Social Security benefits, you just have to go to Medicare and get that enrolled. If you want to go to do both, you go to Social Security. On the screen, you see 3 cards. Your Medicare card with the effective dates of Part A and B you get from Social Security. The secondary health insurance coverage is with Sanford. You will get your new card from Sanford, and the prescription drug coverage or Medicare Part D is through Humana and will be mailed out by Humana. When you go to see the doctor, you will provide your Medicare card and your Sanford card when you go to the clinic. If you need to visit the pharmacy, you just provide your Humana card. So just remember, when you go see the pharmacy, you don't need your Medicare card, you don't need your Sanford card. And again, when it comes to the insurance cards that coincide with Medicare Part A and B card, Sanford comes from Sanford. They're going to mail that out once you enroll. Same with Humana. How to enroll in the Dakota Retiree Plan, you need to have a qualifying event. 2, IndyPERS requires a copy of the Medicare card with Parts A and B. On the card, it will list the Medicare number, the eligible person that has the Medicare, and the effective dates of A and B on the card. Let's not forget, it will also have the eligible person's name on there as well. Third, the member will need to complete the SFN 59562, otherwise known as the Retiree Health Insurance with Medicare application form. And the person, which could be the member or their dependent, is required to complete the SFN 58860, which is the Medicare Prescription Drug Plan Enrollment Form. Where can you find the forums and information going over the information presented in this video? Well, as I said earlier, you can go on the NDPERS website, and here on this slide, highlighted in blue a little bit down there, as you can see, is the location where you can click on our website to go to information about the Dakota Retiree Plan, which is the Medicare portion, the Medicare Part D prescription drug plan, which basically is covered by Humana. And by clicking on those, when you get to the bullet points on our webpage, you can go and find the various information on guides, plans, and of course the forms you need to actually enroll. Here at IndyPERS, we do get questions about whether you should go on the Dakota Retiree Plan, or even if it's a good plan. I can say that it is a good plan, but it may or may not be right for you. That's why it's incumbent on you, the members, to do the research. As you can see, there are things listed here that you might want to pay attention to. Just to give you an idea, I just want to make sure any information when it comes to premiums I'll be going over here, those are cost approximate and they're subject to change. We do renegotiate the prescription drug plan, the Medicare Part D plan as we call it, each year. And then when it comes to the health insurance plan, every 2 years, the newest contract will be redone on July 1st of 2025. So here's what we have now. So just remember, the Dakota Retiree Plan, like say with the One Medicare Plus Other, which again is the Dakota Retiree Plan plus Dakota Plan, may be less expensive for you than others on other insurances, at least until you and your eligible dependent become Medicare eligible. And again, when it comes to these non-Medicare, people can remain on the plan as long as there is a Medicare person on there. And then dependent children can only stay until at 26. Now, with the One Medicare Plus Other, the approximate price tag is $862. Now, when I was talking about that you can have other people on here, just the other day I had a member come in and he was going to go on a Medicare supplemental plan and his spouse was going to go on a non-Medicare plan. And I just asked, well, what was the price of his spouse's plan? Well, for a $6,000 deductible, and just for her on it, it was going to be still about $700. And then his plan that he was going to go on with Medicare for the supplemental was close to about $200 some. And so I did suggest to him, well, did they look at our plan? And he said he wasn't aware that we had one. So I advised him that, for roughly $862, he could go on a Medicare supplemental with IndyPERS, and that his spouse could go on the non-Medicare plan, the Dakota plan, and that price tag would be $862 for both of them, one premium for both of them. Now, let's say if he had 2 children that were under the age of 26. Well, that $862 that you see on the screen there would still be the same price tag for the entire family. All right. So, I mean, when you're going on Medicare and you have family members who are non-Medicare, we might be a better route for you in this case. I'd still make sure that you talk to your financial advisor or your insurance broker to see if there are other plans that might suit your needs better, but definitely give us a look. Now, remember here, gang, that with the One Medicare plan, when it's just one person, the approximate price is $282. If we're talking about 2 Medicare, where it's, the member, the spouse, they're both Medicare eligible, we're looking at roughly about a $571 price tag in that. So I definitely recommend that you do some research. I used to tell people that when they were getting about 6 months to retiring, they should really be looking at Medicare plans. But I've done some reviewing lately, and to be honest with you, I honestly think that you should be doing it at least age 60. I know that sounds like, wow, that's too early, Damon, but no, it's definitely something that you need to make sure that you have a better understanding. You don't want to wait till the last minute to make these judgment calls. I've been talking about the IndyPERS retiree plan, how it assists you with the Medicare plan. Of course, you have questions on it, and I have good news for you. We have a great video on the IndyPERS YouTube. Also contact SHIP, formerly known as SHIC. And even before I was a counselor, I typically was giving members the phone number for SHIC, now known as SHIP. And they have wonderful people who volunteer and assist you in better understanding with Medicare and how it benefits you. I highly recommend, as you can see, the phone number on there is 888-575-6611. And they do a great job of explaining Medicare benefits to you.